Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. We're recording on January 9th, 2025. Before we begin the show, we have some housekeeping. We published a new issue this week with focuses on Medicare, Medicare Advantage, and more. We also released our Health Affairs Best of 2024 list, where we highlighted the most read journal and forefront articles. Check those links out in the show notes. We also announced this week a refresh of our Insider program. So you may know that Insider is our membership program, and this year we are revamping some of its features based on user feedback. Some of the big things that we are rolling out this year as new products are deep dive reports on noteworthy and emerging health policy topics, as well as access to health policy leaders through a new virtual office hours event. So that's in addition to the events and newsletters that you may know and love. This year in the newsletter space, we have on deck Brent Fulton writing about antitrust and markets competition, Stacy Doucette-Zena on drug policy, David Simon discussing the economy, and our own Laura Tolan and Ryan Tanapp writing about health spending and health equity, respectively. We also have some new benefits planned for later in the year, but that's what's immediately in store for you. It's exciting, and I hope you'll join Health Affairs Insider. Check out the links in the show notes if you'd like to join. Going back to the new issue, speaking of Medicare, today we are talking about Medicare fraud with my colleague, Rob Lott. Rob, how are you?
Hey, Jeff, I'm good. Thanks.
So, Rob, looking at Medicare fraud, when President-elect Donald Trump nominated Dr. Mehmet Oz to lead the Centers for Medicare and Medicaid Services, Trump made a point in saying in his statement that Oz would, and I quote, cut waste and fraud within our country's most expensive government agency, unquote. Of course, he isn't the first official to highlight the need to tackle Medicare fraud, but it got me wondering exactly how big of an issue is Medicare fraud? Is it an easy target to blame, or is it a genuine problem? Like, where are we on this? Is it a straw man argument?
Yes and yes, Jeff. I think the answer is yes to both. It certainly is an easy target to blame. You don't find a lot of defenders of fraud out there, at least in the abstract, but it also is a really big problem. I think it's worth starting with the fact that Medicare is just a huge target. You remember what notorious thief Willie Sutton once said about why he robbed banks, Jeff?
No.
He said, because that's where the money is. And in our world, Jeff, of course, Medicare is where the money is. It's just a huge program. In 2023, Medicare spent over $1 trillion in the National Health Expenditures report that Health Affairs published last month. Medicare represented 21% of total national spending on health. It serves 66 million beneficiaries. And so if you're up to no good and looking to make some trouble in the neighborhood, Medicare would be a good place to start. In fact, the Center for Program Integrity, which is CMS's sort of fraud patrol, they estimated that improper payment rate for Medicare was 7.6% or $31 billion in fiscal year 24. The rate was a little lower in Medicare Advantage, but still came in at about $19 billion.
Rob, have you ever seen the movie The Other Guys?
Yes.
Yeah, where they go after the cops' pension fund.
Yeah, that's it. Yeah, exactly. Easy target.
So maybe a fictionalized version of Will Ferrell and Mark Wahlberg should be.
That's right. I'll be Mark Wahlberg in this scenario.
Okay, I'll be Will Ferrell. So going to improper payments. What does that mean? Yeah, what's an improper payment? Like, we love definitions.
Yeah, of course. So it's broader than just fraud. It's really outright criminal behavior as well as abuse, people taking advantage of loopholes, and also simple errors just from the sheer complexity of some of the systems at play here. But that kind of squishy term really does underscore how complicated things are and how there are really a lot of different kinds of fraud and abuse in Medicare. I think the kind that most people go to that they think about most obviously is the idea of providers billing for services that they never rendered. So, for example, a provider submits a claim for a knee brace or a COVID test or a wheelchair on behalf of a Medicare beneficiary that was never actually provided. One at a time, these are pretty small beans, small paltry sums, but in examples of major operations carried out using these kinds of claims at a huge scale. Last year, we learned about a group of companies that was charging Medicare for catheters that they never supplied. Together, 7 suppliers were responsible for about $2 billion in suspicious charges just for those catheters. And, medical supplies in particular are a frequent entry point for these fraudsters. It's easy to set up a storefront, a billing code. And once you acquire a bunch of patients' Medicare numbers, it's not hard to file these kinds of claims.
Okay, so lies being fraud, that's pretty a straightforward concept. I think we can all get behind that. That's fraud, right? Or understand that how that might be defined as fraud. But for maybe something like upcoding, where you're charging $650 for a Band-Aid in a healthcare setting, like is that considered fraud, or what are other types of fraud that's happening?
Yeah, it is, and it does get complicated, and there's like a lot of different ways to kind of slice and dice it. At its very core, fraud is really basically misrepresenting reality. That's sort of the core concept, and so
And this is assuming perception is reality. We're all under the same perception, right?
yeah, I think I'm no lawyer, but the question is sort of what's reasonable and what's not. And so, for example, if a medical transport company claims that it traveled more mileage than it actually did in reality, that's fraud. You've got kickback schemes where individuals who refer patients to a particular hospital or doctor get money in return. We've seen corrupt doctors splitting fees in return for referrals like that in the form of rent or cash payments even, and taking money as a result. You've got double billing, submitting claims to like different payers for the same service. And a big one here also is unbundling, in which basically a provider separates a single procedure into multiple procedures, which they bill separately and then get overall higher reimbursements than they would for that single procedure. So there's lots of different variations, but at the end of the day, this is people sort of taking advantage of the sheer size of the program to leech it really of funds for them for their own benefit.
Gotcha. And I know Health Affairs published an article in the way back time of 2019 outlining the breadth of this. But what's changed since 2019? I know fraud has been talked about for as long as I can remember looking into this.
Yeah, I mean, you're exactly right. And it's hard to say if things are getting better or not, compared to past years. Although I am drawn to that rate I quoted you earlier, Jeff, of 7.6% in Medicare of improper payment rates. It's been at that level for a few years, but in the past, it's been as high as 10% or more. So that alone is a good sign. And the truth is that, I think Medicare fraud is a bit like a mutating virus. As we develop new tools to fight it, new opportunities to cheat come up as well. And the fraudsters are basically developing new ways to make the most of those opportunities. For example, Jeff, it's pretty easy to imagine areas like COVID coming up that obviously, wasn't an issue 5 or 10 years ago. Suddenly, we've got examples of criminals filing false claims for COVID tests. Or think about the flexibility around telehealth and the opportunities that might create for fraud. And then you've got, new treatment and care options developed around artificial intelligence. And you can certainly imagine how the kind of black box within that technology might lead itself to abuse as well. On the other hand, just as, opportunities for fraud have evolved, so have our efforts on the so-called program integrity side. Right. The old model was often described as pay and chase, right? Medicare would pay out all the claims, then they'd go back and review. And if they saw something suspicious, they'd look for clues of malfeasance and track down the bad guys after the fact. To simplify it dramatically, but that's sort of the old school approach.
Yeah, it sounds simple.
Well, about 15 years ago, and by the way, about 15 years ago marked the passage of the Affordable Care Act, March 23rd, 2010. Jeff, can you believe it?
Unfortunately. Yeah.
Yeah. Anyway, since then, the feds have really focused on using things like, complex surveillance algorithms to flag suspicious claims, the same way like my credit card company might send me a notice if suddenly, 10 flat screen TVs appeared purchased in, Pensacola, Florida, or something like that. They're doing the same thing, tracking, Medicare claims. And they've also invested in sort of building stronger ties between the Department of Justice and HHS. They've created this thing called the Medicare Fraud Strike Force, which sounds like it might go well on a NBC procedural or something like that. But I'd watch that. I don't know about you.
Yeah, we can get some T-shirts printed up too.
Anyway, there's a lot going on. But at the end of the day, it's a little bit of a game of whack-a-mole, right? Things change, and so we've got to change our enforcement strategies. And the goal is really just to stay ahead of it if you can.
You mentioned a bunch of fraud fighting techniques. Did you notice if any of this investment made a difference?
Yeah, well, there's certainly a ton of bad guys that have been snared in these efforts, and that in turn has returned a lot of money. I mean, we're talking billions to Medicare. So that's a good thing at the end of the day. Whether or not it's actually reducing the overall level of fraud and abuse, it's really hard to say, Jeff. And I think we can feel good that without those efforts, things would be a lot worse, but it's going to be sort of a perpetual fight.
Gotcha. That makes sense. So, what should we watch out for in the coming administration and policy on this? With all this talk of bad guys, is it really just simply to get Dudley Do Right on a council?
That sounds like fun. If you start with the premise that it's important to reduce the overall level of spending or to slow the growth of spending in Medicare, and you don't want to cut benefits because that would make beneficiaries angry, and you don't want to cut payment rates because that would make providers angry, then targeting fraud seems like the perfect solution. That really won't make anyone angry, except, of course, again, those bad guys. And at 7% of total payments, that's a huge pot of potential savings to draw from. So all that is to say, if I'm coming in with a new administration, targeting fraud seems like an easy win on one hand. On the other hand, it's not like no one's thought about this before, and the most obvious strategies have already been implemented. So it's not maybe as easy as it might seem at first. And finally, Jeff, you know what I always say? It takes money to make money, right?
Right. Yeah.
So in this case,
I was hoping to try to do that improv game where we just say stuff slowly at the same time.
I like that. Yeah. It takes money to make money. And so in this case, if the administration really wants to amp up its enforcement efforts, it's going to have to spend money on things like people to do the work. And so whether or not they'll have the foresight to make that investment remains to be seen.
Yeah. Remains to be seen. Well, Rob, thank you for giving that great overview of Medicare fraud. I think I feel a little bit more knowledgeable coming into the new administration about what could be in store and also what they might be targeting, some targets and some techniques they might use. And with that, is there anything else you want to add before we ship off?
No, thanks for the opportunity, and Happy New Year to you, Jeff.
Yeah, Happy New Year to you. And for those still listening, you can catch Rob as the new host of A Health Policy coming up on our Health Policy channel later either this month or early February. So, Rob, we look forward to working together on that channel as well.
Absolutely. Really looking forward to that. Thanks, Jeff.
Yeah. Well, thanks to you, the listener, for listening to this episode. If you enjoyed it, please send it to the Bullwinkle in your life, and we hope you have a great day. Thanks, and have a great time. Bye.